Turning back right now to the latest on the coronavirus in Connecticut as the state gets ready to distribute a vaccine. A lot of people right now have questions about the vaccine, how to get it, and we want to help you get some answers. And joining us this afternoon is Hartford HealthCare pulmonologist, Dr. Patrick Troy. Dr. Troy, thank you. You were on with us the other day. We appreciate you taking the time again.
Thanks for having me, Mark. Great to be here.
Well, let's get right to the questions here because these are some good ones today. And Linda, first up, she is asking, if I already had COVID-19, do I still need this vaccine?
Excellent question. So the answer to that is an unabashed yes for three reasons. So let me just walk you through the why. So the first reason is that if you had COVID to begin with, right, we're not necessarily sure how strong your immune response was. It seems like it's really variable. Some people really strong, some people not so strong. So it's hard to know what kind of immune response that you had to the COVID virus to begin with. Two, look at this as an opportunity to give your immune system a real boost to COVID. So even if you saw it before, this is a great reminder for your immune system. Have at it one more time. And then three, we know from the data from these vaccine trials that it looks like that the response you get from the vaccine is every bit as strong as having an infection, and in many cases, up to 10 to 15 times stronger than if you actually had the infection itself. So there's three good reasons to get that vaccine, even if you had COVID.
All right, that is very good to know. Now, Joan, she has another question. Is this like the flu vaccine? Will we actually need to get this every year?
Joan, there is the $1 million question, right? So the answer is we don't know because we don't know how long the vaccine lasts for. But what I can tell you is that the trial for the vaccine is ongoing, and they're going to look at the antibody response, not just at these time points, but also at 6 months, 12 months, and 24 months. So to be determined in terms of how long that immune system response lasts, we're going to get that data down the road.
Now, this next question I think is pretty interesting because there's a lot of talk about who will get the vaccine and who won't. But Jason is asking, will there be any way to prove that you received the vaccine? How can you tell if someone else got it?
So I don't know that we're going to be able to know that. I think that one of the real logistical challenges that we're working with at Hartford HealthCare is figuring out a way to get everybody in, make sure they get the same vaccine over the appropriate time periods. As to how that's going to be, whether it's publicly, knowledge or not, I don't think we know the answer to that question yet.
All right. Now, lastly, Erica's got a good one right here. She's asking, how can I be sure that I will be able to get the second dose on time and that it will be the same brand? Does that even matter?
So great question. Let me just reverse the order. So it absolutely matters. So if you get the Pfizer vaccine, which is the vaccine we're talking about right now, you must get the second dose of the same vaccine, the Pfizer vaccine. And if you get the Moderna one, when that comes out, hopefully next week, same rules apply. We are going to make unbelievable efforts, right? We're working at this right now at Hartford HealthCare to make sure that when we bring people in, right, we know, we log, you've got this vaccine, this is your appointment for the next time for the exact same vaccine. So we're going to be very careful about making sure that you get what you started with because it's so important.
Dr. Patrick Troy, thank you so much for joining us again this afternoon. We appreciate it. Everybody's got a lot of questions. We're all, as you know, we're all going through this right now for the first time together. So it's good to know that you guys have control of all of this.
We're in control, Mark. Keep the questions coming. They're all really good. Thanks a lot for the opportunity.
We'll have you back soon. I know we will. Thank you very much, Doctor.
All right.